আপনারা দেখছেন টকিং পয়েন্ট।
সৌজন্যে মাহবুব এন্ড কো অ্যাকাউন্টেন্টস।
Welcome back. Just before this commercial break, we were talking to our distinguished guest today, Dr. Mahmudur Rahman, about this sustainable and integrated healthcare service that Dhaka Community Trust Hospital is providing. Yes, Dr. Rahman.
Well, we choose the word integrated because health is not a segmental thing. Human health encompasses a lot of things. It's primary care, secondary care, tertiary care. But when we went back home, we found that the health system is totally divided in three segments. The primary health care is totally donor dependent and run by NGOs, primary and secondary care. Tertiary care, only few government hospitals and very, very few private hospitals were there. And we thought that there's a tremendous strain on the manpower, health manpower, to subdivide it into various factors. So that's why we decided to integrate the health component as a whole and said a doctor should be in charge of all three segments of the health. And with his team, he should be able to discharge the functions from a source which is quite comprehensive and together. Otherwise, if you fragment it, your cost is more and service falls. So that's why we decided to integrate the health under our hospital and train our staff in a way that they can function in all the three segments uniformly with equal skill. And that how the service is improved in our...
Also the cost goes down.
And cost goes down. So this is how and why we call it integrated health service.
Great. You also are involved with a lot of foreign national and international organizations like Harvard Medical School and Oregon State University, Boston Children's Hospital, Mercy Malaysia, South Australian University, and UNDP and UNICEF. And that's this functional and professional collaboration. Now, how does that impact your hospital and the healthcare system in general in Bangladesh?
Well, this is very interesting. We got involved with all these institutes outside our country because of our activities with arsenic in groundwater.
Right.
In early 90s, when our hospital team used to go out to the rural areas for health camps and establishing outreach health units, in district of Pabna, we came across patients with symptoms of arsenicosis or arsenic poisoning. And then we inquired about it. We found that in particular couple of villages there are patients, and soon we came to know that in that region there's a lot of patients who go to Calcutta for treatment. And we found that in Calcutta, in Jadavpur University, a chap called Dr. Dipankar, he is a pioneer there who started to shout about arsenic in tubal water. And it was very interesting. In Bangladesh, till 50s, most of the people used to drink and cook from rivers or ponds or from dug wells.
Yes.
And hardly any tubers those days. But because of waterborne diseases, UNICEF in particular advocated groundwater use, which is plenty, and started digging the tubers.
Right.
From 50 to 40 years' time, 95% of the population of Bangladesh got their potable water from tubal water. And it was very handy. It was by the side of the kitchen. The housewife in the villages didn't have to go far away to a pond or to a river to fetch water.
It was not that expensive.
And it was not that expensive. But there was a big but. They forgot to do the chemistry work. And the groundwater contains arsenic in Bangladesh.
Right.
And over the years,
Where
became
does
more
it
and
come
more.
from, this
It
arsenic?
comes from actually the soil of Bangladesh, alluvial soil. It
Yeah.
is sediment from
Yeah.
the big rivers.
The rivers
And
bring it every
when
year.
this sediment was there, they brought this element from Himalayas, and it was in the aquifer. When the aquifer, you take the water out, it leaches out and comes with it.
So what happens to these deep tube wells? They are used for agricultural purposes.
Yes, the deep tube wells are free from arsenic in some places, but not all, because deep tube wells are also, over times,
They are also causing damage to the crop.
are liable to get contaminated with arsenic, because the aquifers are not watertight so much. The water goes from one to other. It is a shallow aquifer, that is at the depth of 30 to 40 feet. They are much more contaminated with arsenic.
Right.
But the
How do you treat those
But deeper aquifer are also contaminated.
Right.
Now, there is no known treatment for arsenic, unfortunately. The only treatment is to avoid arsenic.
Yeah,
You
use
have
of-
arsenic-free water. And the surface water, there's river, pond, and dug wells, are free of arsenic. So we advocate now that go back to nature again, use as less as possible the groundwater, and try to use filtered water from river and ponds. But ponds are not very healthy at the moment, because most of the ponds
They're
are
stagnant
derelicted
waters.
and stagnant water. River water is good, and you can easily build a filter,
Yeah.
sand filter, which we built many places in our work in last few years, and they're quite good. You can have water from rivers and other sources.
Let's talk about your work. How are you doing it? How is your hospital involved in it?
Because we started treating the patient, so we said treating is not good enough. We must stop it. Prevention is better
Yeah,
than
the
treatment.
cause.
So we started advocating to the people, giving them the knowledge of how to use the pond water and the surface water and the rainwater harvesting,
Right.
and use that for drinking and cooking. With the tubewell water, they can do the other household work like washing and things,
Yeah.
but not to cook or drink. So that is how we got involved. And in this work, initially, we were not very much welcomed by WHO and UNICEF, because tubewell water was a great success story for them.
Yes. Yes.
And naturally, when he said it's not safe to drink, they took a back and they didn't welcome the idea very much. But later on, they come into fold.
Right.
And soon after, WHO declared it as the greatest human disaster.
Right. What are the symptoms of somebody is being affected by the arsenic? In
Arsenic
the
is
water?
a tasteless, clear thing. You didn't give you any bad smell, or doesn't give you immediate tummy ache in a small amount, which is in the water. But in the long run, say 1 year or 2 years time, you started getting the symptom. In the skin, they get pigmentation. Then you get ulcers in the skin. Then you get internal cancer, particularly in lungs, urinary bladder, kidneys, etc. You also get heart elements. And research is going on the other long-term effect, like reproductive system. Also in diabetes, it has adverse effects. But this is all going on. The research is going on to find it out. Interestingly, last night there was a program in BBC4 about arsenic in rice in England. I don't know whether you are aware of that or not.
Not grown in Bangladesh, I hope.
But no, it's not in Bangladesh. Actually, in Bangladesh now we are very aware, because most of the groundwater is going for irrigation.
Right.
And that goes into the paddy fields and in the other
Right.
vegetables. And there are a risk in the long run
Yes.
that if we're not very careful, then it might go into the food chain as well.
True. True. True.
So this is how now we are advocating that government and particularly Ministry of Agriculture should be aware of this danger,
Right.
and start using the surface water, the river water, and make reservoirs for irrigation as well.
Is the awareness there in the whole country? I mean, like you have started a very good job.
Arsenic awareness is now quite widespread because of the fact the print media and the electronic media flashed our works very much. So much so, it got in late 90s and early 2000. we got tremendous publicity worldwide. We are in CNN, we are in Independent, Guardian, and BBC, in Australian television. So worldwide, and also in Bangladesh, it is very well known now. And in the rural areas also, people are aware of that.
Right.
So,
But are there organizations that are working to...
a lot of other organizations pick up now. And government also has made a policy, and Dhaka Community Hospital takes the pride being the whistleblower.
Great.
And also involving government and making arsenic policy for mitigation.
Dr. Mahmood, I want to ask you, what is the general impression you get about what is the medical scene in Bangladesh? Are things improving? I know that whenever I go to Dhaka, I hear of very high-profile hospitals, private hospitals. They look more like five-star hotels, see. They're very expensive, of course not affordable for the middle class and lower middle class people, see. And those who can afford, probably they go abroad for treatments, see, Singapore or Calcutta or Madras or Chennai, wherever. Our doctor-patient ratio is not very good. We are not very high. As you suggested before, that paramedics, they suffer the same thing because the nurses who are trained, you have an institute, other colleges and institutes are there. But are we producing enough doctors, enough paramedics?
Yes and no. Of course, things are improving. There's a lot more private medical colleges, private nursing colleges, paramedic institutes are there. But the training is not uniform. We need to have much more uniform, skilled trainers and produce better doctors and better nurses and better paramedics. And this will take time. And I think if government is aware of this fact that if they want to provide health service in the rural areas, in the faraway places, it will take a long time to send a doctor there.
True. Dr. Mahmood, can you very briefly ask our viewers, how can we, the diaspora, Bangladeshi diaspora, people living abroad, and we all visit Bangladesh at least once a year, if not more, how can we be of any help to all the medical health care, not just arsenic and not just diarrhea and other things?
Well, I think there are a few things the people over here can do. One is that help Bangladesh in a way that they can advocate the improvements we are doing in Bangladesh in the field health and other areas, support those, not necessarily all the time support financially, but also by their advices and thoughts, and
whichever way they can,
and encouraging us to do these things, and particularly to the younger generation who are here, I will ask them to come more frequently to Bangladesh to see how Bangladesh is growing, and find out themselves, as we did in our younger days, to find out how best they can help in their own fields, particularly in the field of healthcare.
Thank you very much, Dr. Mahmood. We have almost come to the end of the time, and it was a pleasure having you, hosting you, and I hope that we'll meet again someday, somewhere.
Thank you very much.
Thank you. It's a pleasure. Thank you, viewers, for being with us, and I hope you have enjoyed the show as much as we have. A very interesting program we had about the primary and tertiary and secondary healthcare in Bangladesh being provided by some very dedicated doctors that we have. And inshallah, we'll have some more like him. He is a pioneer in his own field, and we'll have some more like the DCH Trust. Thank you very much for being with us. Same time, same channel. We'll meet again next week.